Hi guys, so welcome to my week 21 pregnancy vlog. So I'm 21 weeks and 1 day today actually. I like to do these videos exactly on time, but I was having a rough day yesterday and I didn't feel like vlogging. So I guess I can jump in here with that. I kind of just lost it yesterday thinking about what they found out in the last ultrasound about the baby's kidneys being dilated, and also that we hadn't really got to see the heart to know everything was okay. And so, against my better judgment, I went ahead and looked up what the kidney thing can mean. Basically, there could be a blockage in the kidneys. The baby could have had to pee, it hadn't peed in a while, so there was more fluid in the kidneys. And it's a soft marker for Down syndrome. So that's where what I was kind of lost it about yesterday, because I kind of opted out of all of the prenatal testing except for the NT scan, which I did have done, but it came back normal. I don't know exactly what risk category it put me in, but they didn't say I was higher risk or anything after that. So I don't know. My mind just kind of freaked out about the possibility of having a Downs kid. And I don't know. We would obviously keep the baby because that's why we opted out of all the prenatal testing, was so that, because the ultimate choice we're going to make no matter what is that we would keep the baby. And Downs is not something that is unfamiliar to me. When I was in high school, I volunteered in the MH and DH rooms, and I worked with a lot of kids with Downs. And I love them all. They're all so happy and so eager to learn and loving life, and it's really a whole different mindset that they have about life. And the thing I worry about most with Downs is just the medical complications that can be associated with it. That's the part that scares me. And also my husband has Asperger's, and thinking of having a husband with Asperger's and a son with Down syndrome is a little overwhelming, when you just think about it. But it's a soft marker. It's not a high correlation with Downs, and also the reason I was really freaking out was because they said they wanted to look again at the baby's heart, and they didn't explain that at all. And if you have the soft marker of the dilated kidneys and a heart problem, then the chances are a lot higher. So I called my doctor's office yesterday on Monday, and I said, so tell me about this heart thing, what was the problem? What do we need to look at again? And basically they told me baby was not in a good position to see the heart clearly. I think the baby was breached and turned around or something, and I don't think they could see what they needed to see. So that made me feel better. It wasn't that they suspected something was also wrong with the heart. They just didn't get to see it. So they know that I'm worried about it and thinking about everything now. So I asked if it was necessary for me to wait a month, because they wanted me to wait a month to follow up about this and see if anything had changed and to get a look at the heart for the first time. And I said, is this something that baby has to grow bigger before we check again? Or can I come in sooner and have this looked at, because it's on my mind and it's kind of driving me crazy, and I'd really rather not wait a month to find out what's going on. So they said they wanted me to wait at least 2 weeks, because then it gives them some time to compare. If the kidneys grow bigger, then that would be a concern in that period of time. So I'm going next Monday, to recheck the kidneys and try to get a look at the heart. I'm pretty positive the baby's still breached, though, because I'm feeling kicks really low. So hopefully and maybe I can get on my hands and knees or something so they can get a look at the heart that they need to. So that out of the way. I think that's just a normal, like, I don't know what you guys are going to think of my reaction to, like, just thinking about all of that, but I feel like it's a normal part of the process. Like, if you find out something could be wrong with your kid. For me, I always, like, think of worst case scenario because I'm pretty educated in medical things, and if I'm not, I know how to find out about something. And so my brain always goes worst case scenario and then dials it down. It could be something as simple as he hadn't peed in a while. So you just kind of imagine what your life will be like in the worst case scenario, and then anything that happens less than that is going to be a relief instead of, like, the other way around. So I don't know. That's just me being honest with what I was going through yesterday. I feel better today. We looked up the actual risk of, like, having Downs for my age, and assuming everything was fine with the NT scan because they didn't say anything. And I looked, like, the NT scan looks pretty similar to my other kids. So, yeah. I don't know. We'll see next week. Hopefully we get some answers. And hopefully the baby's kidneys are fine, and the heart is fine, and everything's fine. That would be the answer to my prayers. Okay, so I already said the baby is still kicking low. Kicking straight into my cervix and my bladder, and it's uncomfortable. So I've been doing some slight inversions every day and putting music, like, low on my belly to try to get the baby's head to, like, come down and see what's going on. So far it's not working. But there's no harm in trying at this point to tempt the baby to flip around, because kicks to the cervix are not my favorite. Okay, so for getting ready for the baby, last Monday night, actually, we went and got paint, and I was just going to test a small area to see if I liked the paint color, but I wound up painting the whole nursery by myself because, I don't know, it wasn't, like, anything difficult to do. So I painted the nursery with, like, a gray color. I think I have it here, actually, the paint swatch. I might have shown this to you already. It's the color. It's hard to, like, I don't know, against green, can you tell? It's gray. So that's done, and I'm reading my list down here. We got the crib out of the crawl space here and took it up and put it together. Got the mattress out of there, took it up, and then the changing table was still in there. So and we took the rocking chair you've been seeing in all the videos right here. We took that up, and that's in the room. So a lot of the furniture in the room is up there. Now we just have to kind of decorate it. So I will put some pictures in of what it looks like so far. The theme's going to be space / Doctor Who, so you can see some, like, things that we have in there. There's a TARDIS shelf that I made, and a TARDIS light switch cover, and then an exploding TARDIS blanket. And that's, like, the theme stuff that's in the room so far. Then last Saturday, we had our first prenatal with our doula. Yeah, good girl. And Megan came over. Her name's Megan, my doula. And we just chatted. She's a friend of mine because I'm a doula, and so I know her from the birth community. And we just kind of talked about my wishes and things that I liked in my last birth and things that I didn't like in my last birth, and you know, what I hoped would be the same, if I hoped anything would be different. We kind of talked through staying with my provider versus switching to the midwives. And she got the same sense as what I've been telling you, is, like, even though I want a midwife, I think I have a OB who is a midwife in disguise. Like, that's how she practices. And her backups are very similar in belief and philosophy of birth to her. And, yeah, she just got the sense of the way I was talking is that I wouldn't want to switch, and she did not say I shouldn't switch. But in the back of my mind, I'm like, oh, I want a midwife, but really, I don't want to be at that hospital. I want to labor in Water. I don't think I will get to because it's too far and it takes too long to get everything set up at the midwife hospital. So I'm pretty sure I'm staying with my OB practice, and we also keep not knowing how high risk this pregnancy is. Because like we were worried about my blood, and that seems to be stable for now. And then also now with the baby's kidneys and the heart, and we just don't know yet. So I didn't want to switch to midwife practice to get referred to an OB if I risked out. So it's kind of, I think I'm at peace with staying with the OBs and getting ready to go to this hospital that I like, that I've been to twice before and had no complaints. So I think we're staying with the practice that we're with. Oh, and then this is one random side note. I was really nauseous last week, and it's funny because I didn't really have morning sickness this pregnancy. And then I was watching my vlogs back from Annabelle, and I was very nauseous with her for the first trimester. And then I was watching the 20 and 21 week vlog, and I noted that I was nauseous again with her during that week. So I just think something that happens in this week or two of pregnancy hormonally must trigger nausea for me, because I was really nauseous. Like, I didn't even eat anything hardly all day until like probably 7 or 8 o'clock at night, and then I was hungry, and then I could eat. And then I probably was still nauseous, but I slept through the nausea in the night, and then I woke up feeling nauseous again. And I tried eating like one day when I was nauseous, and like it didn't help. It didn't relieve the nausea. So I don't know what that's all about, but I'm feeling better this week, so that's good because nobody likes to feel nauseous all the time. Yeah, I think that's it for this week. I will show you the belly. I think I've gained around 15 pounds without pulling open the app and doing the actual math. I think it's about 15 pounds now. So I'll show you the belly, and then I will see you ladies next week. I will probably wait to film. It might be next Tuesday that I film, because I'll probably want to update on the ultrasound, and that's Monday afternoon. So I'll probably be 22 weeks and a day or two by the time I film that. But I'll show you the belly, and then I will see you next week. Alright, there's the belly. And from the front, from the side. This is a maternity shirt, so it's kind of looks bigger. But my belly button's right here, and my uterus is just a little above it now. So it's growing. He's growing. Oop, bright light. Alright, so I think that's it for this week, but I will see you ladies next week, and thanks for watching. Bye!